This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Direct primary care has changed my life, and I have thought of little else over the last 10 years, and I'm excited to be over the hump and finally starting my own practice. I am Dr. Brian Blank of Ember Modern Medicine, and this is my DPC story.
Dr. Brian Blank is the founder of Ember Modern Medicine, a direct primary care practice in Greenville, South Carolina. Ember Modern Medicine is a family medicine practice offering a more comprehensive, personal approach to medicine, including unlimited access to the healthcare team, same-day visits, and clear costs. Direct primary care practices like Ember Modern Medicine focus on the doctor-patient relationship, bringing medicine back to the way it should be. Dr. Blank grew up in the small town of Waterford, Pennsylvania, delivering newspapers as a teen before leaving for the Midwest to study journalism at the University of Missouri. He spent several years working in cable news in both Atlanta and New York City. While living in New York City, he met his wife, Laura. As he got to know her parents, he spent many late nights talking with her father, a longtime primary care physician at the Cleveland Clinic. That was when he realized he wanted to switch careers and become a family medicine doctor. After stops in Boston and Costa Rica, Dr. Blank moved to Chapel Hill, North Carolina, where he completed medical school at the University of North Carolina, followed by residency at Duke University. In 2021, he opened Ember Modern Medicine, a direct primary care practice he had dreamed about for more than a decade. By eliminating overpriced insurance restrictions, he's now able to spend more time connecting with his patients and focusing on health and well-being instead of rushing through 15-minute visits with a checklist of questions for insurance companies. Ember Modern Medicine offers a range of healthcare services, as well as telemedicine, after-hours, and home visits for members upon request. Monthly memberships range from $80 to $100 per month for adults and $20 per month for children. Ember Modern Medicine also offers business packages to small and medium-sized businesses looking to offer health benefits to their employees. In his free time, Dr. Blank enjoys competing in endurance sports. He's run more than a dozen marathons, finished second in a 50-mile ultramarathon, and barely survived an Ironman triathlon. More recently, he's been attending Swamp Rabbit CrossFit. In January 2021, he started a running streak and is attempting to run at least 1 mile every single day. Dr. Blank has been quoted in CNBC, the Greenville News, DPC News, and Upstate Biz, South Carolina. He and his wife live in Greenville, South Carolina, with their 2 children. Welcome to the podcast, Dr. Blank.
Thanks for having me. This is great.
So, like you said in your intro, you have been wanting to do DPC for a long time. And
February of 2021 rolled around and you finally did it. You opened up your practice. You opened up Ember Modern Medicine. And I want to ask, and I wanted to say congratulations for first of all.
Thanks. No, so it's so exciting. And hopefully as we get more patients, they will also be excited. They will share the enthusiasm.
And I want to just say, if you haven't gone and seen Dr. Blank's social media posts, please go check out his Instagram, because you can see that not only is his practice named Ember Modern Medicine, there are actual embers in the front of his building, which is pretty incredible.
It's true. We have some gas lanterns out there, which I think are really cool. And we've turned the flame up as high as they can go, just like in our hearts. It's the ember of our hearts. It's blooming and blossoming. It's becoming this wildfire. It's going to take over healthcare as we know it.
That is what all of us are pulling for sure. And what all of us are working towards every day with every patient. Now, absolutely. I wanted to ask, in terms of this idea that you had thought about DPC for the last 10 years, can you share with us, what was that experience like in terms of how did you come to learn about DPC, and what things were you thinking about through the years as you worked your way towards opening?
That's a great question. Medicine was a career change for me. So I was originally in journalism. And when I made the decision to go into medicine, I knew I wanted to do primary care. I had met my wife and her father, who is a longtime internist at the Cleveland Clinic, and was talking to him about what he liked about primary care and what I liked about journalism. And we saw this sort of overlap. So we decided to make the plunge. So switch careers, but I was trying to find a way to make primary care work, because I was talking with so many folks and they were talking about, oh, you're going into medicine. You've got to be an orthopedist or some specialist and do something really fun. But that's not really ever what I wanted to do. But I had trouble figuring out, how is it feasible to do primary care? Because it sounds like so many of, and this was 15 years ago, so many primary care docs out there were getting burnt out and were leaving the field altogether. It just didn't make sense. But yet alone, as an early med student, I knew many of my classmates were going into medicine because they were really pumped about these ideas of primary care. So it was through the North Carolina Academy of Family Physicians. They had a program for folks who are interested in family medicine, where they basically gave us that first summer after first year a bunch of opportunities to look into different types of practice. So I built this elective with their help, and where I got to spend a few weeks with a bunch of different types of primary care practices, including a straight up concierge practice. So I was at a MD-VIP. I got to see a traditional private primary care practice, spent some time with some med-peds docs and that sort of thing. And so I got to see how that worked. Part of another completely independent doctor, and then direct primary care doctor, Brian Forrest in Apex, North Carolina. And it was at his practice that I first discovered or heard about primary care. And I thought, holy smokes, this is everything that I've ever thought you could get in primary care. Basically, all this time, it was just this amazing experience. It was this epiphany, like this, aha, this is how it should be. And he'd been doing it at that time for at least 10 years. I couldn't believe it. There was no one else that I'd heard of who was doing it at the time. And he had been doing it for so long. And it was his vision as a resident. And he went straight out of residency and opened it up. And it's just been doing great ever since. And so, yeah, since I saw that, I knew, okay, this is what I need to do. We got to find a way to make this happen. And so, yeah, I've spent pretty much every waking hour, it seems like, over the last 10 or 12 years, daydreaming about making this work. And it can work. And I'm so excited about it too, because I feel like, a lot of those friends who I started medical school with, who were really excited about primary care, and then they ended up specializing. I think if we can make a show that this really is an exciting way of doing primary care, it's a legitimate way. It's really the dream of, I think, what primary care can be. Then I think we will get more med students going into that. The pipeline's going to expand. We're going to get this sort of renewed enthusiasm towards primary care because we need it. So hopefully it's going to happen.
It's interesting because when you talk to people, even younger people, about a family doctor, one of the ways that I feel is effective when direct primary care physicians speak to patients when they're marketing or when they're pitching their elevator pitch is to say, it's just like medicine used to be. It's just like how a doctor used to come into your house and help you at your house rather than you having to go to a clinic. And with this idea that the movement is growing actively, and as we inspire each other, as we inspire others to do direct primary care in the future, it's so interesting that it is at the same time going back to our roots as physicians, especially in primary care, and refocusing on patients, but using that history to help people understand where we're coming from.
Oh, totally. And I get that question a lot because patients will come up and ask about our name, which is Ember Modern Medicine. And they're like, what is modern medicine? What does that mean? And I go through this whole spiel about direct primary care, but really I'd say, we're calling it modern. It feels modern. It seems modern, but really it does seem, it's old fashioned at heart. This is really how medicine used to be. We used to have longer visits with our doctors. We used to be able to be more in touch with them. And we weren't always burdened with things like paperwork and these gigantic hospital systems. And yeah, it's modern, but it's retro at the same time. We could call our practice Ember Retro Medicine, and it would still have the same effect.
It's definitely something to consider. If there's somebody listening who is working on their name, it's something to think about. And I also think about the idea that, that people have had to change their names, sometimes because of trademark issues, sometimes because of just a change of heart or a change of location. But I feel that no matter what your name is, you're right, that you literally can name yourself anything. And what you put behind the name is really what matters.
Totally. Oh, yeah.
What pushed you to the point of today is the day? Today is the day that I'm going to do this and make DPC a reality for me.
Have you ever seen The Avengers?
Yes.
It's like Thanos. I am inevitable. The decision for direct primary care, it just felt like it was inevitable as soon as I saw it. There was just no turning back. It was this unstoppable force. It's got to happen. So just thinking about this reminds me of, I feel like a lot of folks when they're in med school, they come up with this idea of what it is that they want to do, or they come up with a checklist and then they cross things off, and primary care gets crossed off because it just doesn't seem practical. But for me, it always felt like you should figure out what it is that you want to do, even if it's not practical, and then just find a way to make it practical, find a way to make it work, because do you really want to spend your whole career as a dermatologist if you don't get joy out of it? Maybe it pays well or whatever, but you've got to really enjoy, I think, waking up and going to work if that's what you're going to do for your whole life. And so I find primary care is just so much more meaningful, and getting to spend and know patients over a long period of time, I think it's worth it. And so maybe you have to make some radical decisions in how you structure your life and your career. Maybe you're going to be independent, which doctors just aren't doing anymore. But maybe you've got to think differently. And in the end, it works out, hopefully. But yeah, it's going to take some big thinking, I think, to follow those dreams. And in the era of COVID, it's just made things like grand openings an odd thing to plan. Do you want a big party? How are people going to take that? If it's a doctor's office, do you really want to have a big maskless event or something? Do you want to do it online? Is it still a grand opening if it's an online party? Do we even need a grand opening? These are all sorts of questions. But yeah, we've opened the doors and we're still getting everything in place. But yeah, we decided, I think it's going to be helpful for us, I think, to just commemorate it, even if it's not that big of a party. But we'll see. My wife's planning it. I think it's going to be a lot of fun.
And your wife, who is the owner of Keylight Communications, sent me a downloadable link where I could find all of the information that I needed about you prior to your interview, just in one magic Dropbox folder with subfolders. And so wow. A huge compliment goes out to her.
Yeah, she and I both met in journalism, and she has started a public relations company. So it's been just invaluable having her as part of this startup. In fact, I was telling her last night, I wish we could have her full-time at our practice and find a way of making it work. So she's just donating all this time, and it's just been so helpful. There's all these things to think about and not enough time in the day to think about them all. But boy, she keeps us organized.
So the building where your clinic is located was a regular brick front building initially. So
yeah, had been a bank.
Oh, okay.
And the bank has left its vault with us. So we have on the ground floor where our clinic is a vault in there with a giant vault door. And we tell all the kids, that it's going to be where all the bad kids are seen. They get locked in the vaults. And the bank was nice enough to leave us 2 giant safes in that vault, including a 6-foot tall safe I could walk in where they kept all their safety deposits. And that safe is probably like 4,000 pounds. And I have no idea what to do with it. It was like basically this gift. But I got a quote just to move it, and it would be $1,500. And then where do you take it? Even if you were to bring it home, you've got to have some pretty strong floors to be able to support a safe that weighs that much. So I don't know if you know of anyone who needs a safe. Let me know, because we've got 2 giant ones.
If you do keep it, I think you should call it Alcatraz. And the second thing that I think of is that would make a great interactive social media post for your patients as well as the world of DPC, because I feel that you would get a lot of interesting answers to that.
Oh, yeah. We did make a post actually when we locked ourselves out of the safe. And so it got locked somehow. I still don't know how it happened, but it's big. It just would not budge like a safe should respond. And so I called the company that built the door. And then I called the company that bought that company. Then I called the company that bought that company. Then I called the company that made the little dial that you spin on the door. And they're like, we have no idea. And then I called the bank and they didn't know. And then they called a second bank. And then second bank was like, just try turning it left to 50 and then all the way right till it stops. And that was it. That was, they had reset. That's the generic clock. If you're ever in a bank, you're wandering around, you want to impress somebody, try that combination because it might work. And then it opens up the door. At one point, one of those companies, they were like, you know what? These things are so rigorous. Probably the cheapest thing for you to do is just go through the wall next to the door. Just go around the door and then you'll get back in there. I was like, oh, okay. We could try that. We'll call that plan B.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
You could just go watch The Italian Job and get the details as to how to manage that job. Oh my goodness, that's right. Intense. Maybe you could use the vault to rent out to house medical records, since we have to keep them for 7 years after closing practices.
Totally.
Just change the default code.
Controlled substances, maybe. Who knows? We can store everything in there. Actually, this is interesting. One of the suggestions that the bank had given us for what to do with the vault, they said, wait for legalized marijuana in South Carolina, because those dispensaries, apparently you can't keep a bank account. So they actually buy up these old bank vaults because they have to keep a lot of their stuff in cash. So they said this was off the record, but now that we're talking, it's on the record. They said, if you just wait until marijuana ever becomes legal in South Carolina, I bet dispensaries will be popping up and then they'll need something like a giant bank vault. Not the vault, I guess I should say the safe in the vault. They could take the safe and use it in their place.
There you go. That was
just interesting idea.
Yeah, there you go. That's thinking out of the box.
Thank you, bank.
In addition to this lovely safe that has been included in your building, can you share about how you decided that was going to be your clinic space?
COVID really helped with it, actually. The Greenville real estate market has just been booming, and it has been for decades. 2008, things never really seemed to slow down around here. We moved here about 3 years ago, and we were looking for a spot that was in our neighborhood, because ideally I would love to have this practice that's walkable. And plus the neighborhood that we live in there's really no primary care or urgent care in the area. It's underserved in a sense. So there was a little lot that was on the market and that we were looking at, but it would involve building a whole new building. So we spent a lot of time looking at it. We drew up plans for it. We just could not make the parking work and make it make sense. And so finally, right as COVID was basically starting to shut everything down, we stepped away from that and we're like, all right, we're going to need a plan B. That same day that we stepped away, this building came on the market. And like I said, it had been a bank. It was 2 stories. It's 7,500 square feet. So it's way bigger than we would really need for a clinic. And we took a look at it, decided we were going to make an offer, and then COVID shut everything down. So no one else was able to look at it or make an offer. So by the time everything opened up again, we had made the only offer on it, which was awesome. And then so we got in there, and our goal is to rent out some of the unused space on the second floor and even some empty exam rooms on the first floor. If we can find some other health and wellness related folks to partner with. There's a massage therapist who I think is going to use one of our rooms. There was an acupuncturist who's going to look at maybe one of the other rooms. And there's a counselor who's upstairs. So that's really great. And yeah, so we're trying to make the best use of the space, but we purposely built on the second floor a big room that we want to use for teaching and shared events and even cooking demonstrations and that sort of thing. So we really want to make it accessible to the community and open and hopefully a lot of fun.
When you guys were envisioning your practice, did you want to have space for the communal events and for cooking classes like you're describing?
Totally. Yeah. That was always one of the plans. We tried to find ways to make it work. And even if it's just doubling over as a waiting room, with DPHC practice, we typically don't need a huge waiting room or anything like that. But because you don't have patients who are sitting waiting around for all that long, like a traditional practice. Yeah. We really want to have a space like that and make it work, and for it to be a place that's comfortable for folks that they maybe enjoy coming to. So we're trying to get some events lined up now. And my wife's she's so excited about it. We've talked to so many nutritionists and other folks, people at local gyms who can come give demonstrations. There's a physical therapist who wants to do a class over there. Maybe we could even do some meditation stuff. I think it's a fun use of a clinic, I think.
For the acupuncturist, for the massage therapist, for other people who might be physically sharing the space with you now or in the future, have you guys talked in the sense of, yes, here's a space that you could absolutely rent. And also let's talk about if we can come up with packages for an Ember Modern Medicine patient who also sees you as a physical therapist.
Yeah. Make it kind of like a little hub if we can, and make it so that those things are optional. But especially with the counselor who's in there right now upstairs, they've just got a great practice and they're new as well. And so we really want to help, feed each other as best as we can. So yeah, any way that we can make that work, I think it'll be great.
When you were doing your build out, when you were personalizing the space to make it what you envisioned, can you share about what the experience was like working with contractors?
Yeah, as I'm sure a lot of folks will know, there's definitely pluses and minuses to all that, but it's overall been a pretty smooth experience. I will say one of the things that excited us in starting this was we have been working with a great architect, and they had come up with maybe a vision for how this would look. And we went to some local interior designers that came up with a package for our clinic. And as I'm sure most of us, if we ever talk to any of these folks, we all say, we don't want our clinics to really look like a clinic. Let's make it look cool and not so sterile like a lot of the hospital-based clinics and all that sort of thing. And they put together a package. They said it was pretty cool, but it looked just like every other hospital clinic that I've ever seen. Very sterile. Everything's made to be very cleanable, probably meets certain OSHA standards or whatever. And it was super expensive. This furniture, which did not look great, was so pricey. And for the same price, we're like, gosh, we could go to basically like a luxury designer and get some really nice furniture from a place like Restoration Hardware and throw that all in there for the same price. And it looks a lot nicer. It looks a lot cooler. And the way that they make those things, they're easy enough to clean now that for a low volume clinic, I think it makes more sense. So that's what we did. We're like, gosh, if we're going to be paying a lot of money for furniture, let's just get some nice stuff. If it's the same price, might as well. that's been fun for us.
Can you think back on any particular challenges and how you overcame them when it comes to the build out process?
The builders told us that there's three things to think about when you're building something, and you can't have all three of them. You can have two of the three, but you can have it done fast, you can have it done cheaply, and you can have it done well, I guess. Maybe I'm not remembering it, but basically, yeah, you can have two of the three, but you can't have all three. And so for ours, we had the benefit of having some time because I was employed. And so I could continue that job really until the practice was up and running. So we decided we're not really concerned about the time. So we'd rather spend our time and make it all work out. And it doesn't need to be super expensive, but it doesn't have to be done in 4 weeks or whatever. And so that for us was really helpful to be in a position where we could continue to work and wait for everything to come together. But overall, the build out was pretty smooth. I want to say it was maybe four months.
That's not bad.
Oh, one frustrating thing though. So this was helpful. I've seen different posts about this in the DPC group. So we ended up taking out an SBA small business loan from a local bank, and they have just been really a godsend for us. It was so great working with them. And COVID helped with that process, actually. So when COVID happened, it really loosened a lot of the lending requirements from the government. And so the bank was able to take a bigger risk on us, or take on more risk because the government was shouldering a lot of it for them. And so that was really helpful. So I would, encourage folks, if you're thinking about something like this, maybe reach out to local banks and consider the SBA route if you need to. It can take you have to knock on a lot of doors, I think, to find the right bank that's willing to take the time to understand direct primary care and what it means and what it can look like. But when we found the right one, everything just clicked. So that was really helpful.
That's a great tip. And I hope as the movement continues to grow that if people are not sure which bank to approach, they can potentially reach out to another DPC in their community to get advice as to where to look first.
Yeah, I think that's a great idea. And yeah, don't look at the big banks. Don't look at SunTrust, Truists, and those sorts of things. I think it's really going to be a smaller community bank that's, going to take the time to really understand the model and what it can mean for the community.
Yeah. And I wonder if that's also because just being closer to the community versus being closer to the corporate world, if that makes sense, that they're more aligned with the community values.
Totally. Yep. I think that's exactly right.
With you mentioning this idea of restoration hardware and finding pieces of furniture that were really nice, still easily cleanable, but really brought home what you wanted to make your clinic look like. I wanted to ask, how did the marketing happen for your clinic in terms of, did you come up with your colors and designs and what you wanted the clinic to look like before you came up with the name, or did it happen in the opposite fashion?
We reached out to a marketing company before we even had thought of a name, and they helped us with the whole process. And I would encourage, so I've gotten different advice from other doctors about this over the year about how much to invest in marketing and advertising, because at the end of the day, a lot of docs, they'll say it's really word of mouth that sort of drives things. But for us in starting the practice, we would like it to be a brand. Like, I really want this to, be something that really hangs out in the community for a long time. And so reaching out to a local group that was also willing to work with us, I think has made all the difference. So they helped us come up with a name and a logo and a website. They are helping us with advertising right now. And I think it's worth investing in that. And if you're going to do it at the start, it's so much harder if you come up with a name and a logo just by yourself for a year or two until you get established. And then you decide to go back and sort of work with a company to get all this stuff off the ground. If you can do it all from the get-go, it's a little more work up front, but I think it's going to pay off in the end. It's just going to make things easier. You're going to come off as more polished, I think, when you do open. So that can make a big difference if that's what you're going for. If you're truly starting a micro practice and that sort of stuff isn't important to you, you're not really thinking, you want to hire other docs or really expand it in the future, that's totally fine too. But if you really want to establish a clinic or maybe even have multiple sites in the future, I think it pays off to invest in that upfront.
What did the finances look like in terms of budgeting for the build out, as well as the marketing piece, as well as potentially looking for staff? Because you have Allison, who's your RN?
Allison Smith. Yeah, she's our nurse. Yep.
Yeah.
Yeah. No, she's been great. So yeah, it's been tough. I'm not going to lie, we've put it all on the line there. We've drained all of our life savings, and if this doesn't work out, then we've got nothing. But it's been an exciting gamble. So if a year from now, if we're continuing this and I'm doing it from the bread line downtown, then we'll know that it wasn't a great idea. But I think it's going to be a lot of fun. We had to make some tough decisions, and I think it was really important for me and my wife Laura to be on the same page about how we were going to spend our basically our savings and what that's going to look like. And it's so terrifying being in the medical field and starting with a lot of just training debt to begin with. Maybe it's good in a sense that it prepares you for living with this overwhelming debt sort of thing is just hanging over your head all the time. But then adding to that with a building or a practice, it's a lot to think about. So maybe sometimes it's worth not thinking about, but pressing ahead, I think, despite all that, you just got to do it. Sometimes you just got to take a jump. And so we're taking that jump, and we'll see how it pans out.
In addition to Laura's company, for you, are you doing any side gigs right now?
Totally. Yep. I am working at a couple of the local urgent cares, PRN as much as I can get. So yeah, that part's tough. And I am just counting down the days to when I don't have to do that anymore. But luckily, they've been really flexible with their schedules. So right now, what I'm trying to do is work every weekend day that I can find so that I can be in our clinic during the week. Still trying to find one day off during the week just for my own sanity. But for the most part, yeah, working weekends or weeknights if I can. So maybe sometimes I'll see patients in my clinic in the morning, and then I'll go over to the urgent care in the afternoon or evening. So far, it's worked out, but yeah, it's exhausting. So like I spent all the day in a windowless room in an urgent care and really wishing I could be in my practice or at home, but eventually that will hopefully be the case.
Are you giving yourself a salary right now or not yet?
Not from the clinic. So we've taken probably the opposite approach from all the advice that we've ever gotten before, where we do have a lot of overhead to begin with. And so I think it's going to be a while before the clinic's able to support itself. It doesn't have to be that way. I think you can definitely start out a practice. I've heard some folks say you could do it with $5,000. You could start a micro practice. But yeah, so I think it'll be a while before we have a salary. So I'm going to, probably be doing the moonlighting thing for a while, which is fine.
Do you foresee your practice maxing out at a particular point in terms of number of patients that you wish to handle as a doctor?
Yeah, I would say right now I'm setting that target for somewhere between 600 and 800 patients. So we'll just see. It's really just going to depend on if we get to a point where we feel like we're not able to still provide that sort of same day or next day service. If it seems like things are just too busy, then maybe we'll cap it before then. But that's just generally what we're aiming at. See if it feels sustainable.
How did you determine your pricing?
A bunch of different factors went in there. It was definitely helpful to be on all the great work that Josh Umber has done with the resources that are available through Atlas on how to determine pricing out. That's all been super helpful, and been studying that stuff for years. Also, just looking around in our community and seeing what sort of the community seems to support. There are other direct primary care practices, in our area, and then there are also full-on concierge. And so trying to find some middle ground between that, I think was helpful. So we landed right now at about $100 a month per patient and $20 a month for kids, if you're doing month to month, and then discounts for yearly stuff. So we'll see. We can always tweak that as needed, which is one of the nice things about direct primary care. You just adjust as you go. But that feels like it's a sweet spot. I think in the middle, it's affordable for just about everybody. But if we hear that it's not, then we can always change it.
In terms of the offerings you have listed on your website, you have listed urgent care, in-depth annual physicals, body composition analysis, and prescription programs. And so I was wondering, for things like an urgent care after hours visit or a body composition analysis, are those things included in your membership, or are those things separate?
Yeah, those are included. So the body comp analysis is it's basically just a machine that we bought that can really help us with that. And I think it's a lot of fun. It gives us a lot more information than a traditional sort of BMI. And that's something too, where I feel like it's a good draw for the clinic. So one of the great things about direct primary care, I feel like we can experiment with these technologies. We don't have to wait around for Medicare to figure out if it's going to reimburse us for it or not. We don't have to just use a scale anymore. We can use these types of machines and give us a sense of what our body fat is, which is, by the way, also a very humbling experience to get that sort of feedback on how small my arms are and how much smaller my legs were than I thought that they were in terms of muscle mass. But anyway, it's been super fun. And that's a draw for the clinic. I think it's a fun thing for us to be able to go to gyms and say, hey, by the way, if you have anyone out there who's going through a Get Fit sort of program and you want to send them for a body analysis, we're happy to do that. We get to partner with gyms that way. So it's definitely a fun outreach. And then for the urgent care stuff, we want to be able to do that for our members as it's become available. So that's another reason that I'm really eager to stop the sort of outside moonlighting thing so that I can really be available, as needed for my own patients on the weekends or after hours. But we haven't had to deal with it yet. But when we do, I hope to be able to pull over, see folks in clinic or do house visits as needed.
When you're describing how you came up with your price point and looking to the local community for what was a good middle ground for you, I want to ask you also about your market research when it comes to insurance prices, because you have a table on your website where you compare what it costs in your direct primary care to what it costs in your community if you were to use insurance. And I'm wondering, with your experience at the urgent care, did you know some of those prices beforehand before making the infographic, or how did you find that?
Yeah, totally stole that from the urgent care that I was working at, because we do have a list of the cash pay prices. And that I think is still so fascinating that if you go into a hospital-based urgent care, they've got these cash prices that might be as much as 72% off of the insurance rate for these procedures or whatever, but it's still nowhere near the sort of the wholesale cost of what these things cost. Like I was seeing a patient the other day at this moonlighting clinic, and she's a medical student. She's a second-year medical student, but she's away from home because of COVID, so she's studying for her boards. And she had a question about some muscle cramps. And so I thought, great, let's just get a BMP. So she's uninsured with where we were. She was cash pay. And she's like, what's the price for a BMP? And I said, let me go check. So I go out, I pull out the list, and was flabbergasted to see that the BMP was $55 for the cash pay patients, and the CMP was $77. And I told her, I was like, I don't think it's worth us getting it. It was pretty minor what she was in there for. I was like, let's not get the lab because it's so expensive. In my clinic, that lab is $1.50 and the CMP is $1.70. Why is there market? And that's for cash price. The insurance, what we get billed for insurance is just absolutely astounding. The way people get ripped off in the traditional healthcare system just makes me mad.
Yeah.
So yeah, I don't know.
The discount off of expensive is still expensive.
Right. Yeah. And that was eye-opening for me to learn. I learned that from Brian Forrest in his practice, that the reason you can't just walk in off the street, let's just say my brother owned a primary care clinic and I didn't have insurance and I wanted to go in, and he's, oh, you're my brother, I'll give you this great discount on your healthcare or whatever. He can't charge me wholesale prices for things because he signed these insurance contracts with Blue Cross or whoever. They won't let him do it. You can still give a discount to cash pay, but still, it's nowhere near the actual cost of delivering these things. Primary care does not have to be expensive. It's insurance that makes it expensive. Man, I wish I could just shout it from the rooftops. It's destroying healthcare.
I just want to highlight what you said in terms of that you had this information from your urgent care. And so if you are looking to develop pricing for your own practice, that is definitely something that you can do, is literally call your local urgent care and ask them, because you technically are a patient as well. If you potentially would need something and have to go there, you would want to know the pricing. So you can transparently find out pricing from urgent cares around you by just calling. And it goes beyond just getting the cash pricing from imaging and lab centers.
And I found what feels the best is for that sort of thing. I like the idea of just including it with the membership and not really even just charging that $1.70 or whatever it is onto the patient. So I try to roll as much of that really into the membership for free as basically a covered cost. I know there's different fields of thought on whether we should do that or not, but for me, I feel like it feels better. And to my patients, it's just been astounding. They're like, I just walk in and I get these labs done and there's no extra cost at all. It's just fun to be able to say, no, we got that. That's what we're here for.
I want to point out too, when someone's even looking for the price of a medicine in particular, something that you can also do to find out your local prices on medications is contact your pharmacy and make friends with the pharmacist. And you can call them and ask them, how much does metformin cost if you were just going to pay cash for 30 days, just from your perspective? You can always find on GoodRx, you can type it in. Mm-hmm. But I found that in our local pharmacies, there's two major companies, and the pharmacists, when I have spoken with both of them, it's sometimes different than what GoodRx has listed. And so totally. It would be interesting. Yeah, it's another tool to have in the toolbox to make good friends with people who are in the system still, to know what your competition is like.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Yeah. And I found in talking with pharmacists too, that they seem to be just as frustrated with the system as we are. I feel like I have this conversation every time I accidentally send in the wrong eardrops for swimmer's ear for my patients, and they get to the pharmacy and they're like, $280 for Ciprodex. It makes no sense. And then they call me and they say, would you like us to switch it to the $8 alternative? And I say, yes, please. That would be fantastic. I wish I could know that ahead of time whenever I send this stuff in. And the pharmacists, they're just as frustrated, I feel, as we are at this sort of cloud of secrecy over pricing.
Absolutely. I go back to Dr. Natalie Gentili, how she's working with Blueberry Pharmacy, which is a cash-based pharmacy, and they have a collaboration between her clinic and the patients who go to Blueberry Pharmacy because of that frustration. Exactly. And I think about it. My best friend from high school, she is a pharmacist, and she, during my years in medical school and residency, would occasionally have a conversation with me about a certain medication and would be exasperated at exactly what you're talking about. Like, how does this pill, this generic pill that's been on the market for decades, how does it cost this much when a person uses their insurance? And it highlights the point too, that as DPC physicians, the mindset is not to make the most money by upcharging on every medication that we have available to our patients, or upcharging for the fact that you have a body composition analysis. And pharmacists also are not sitting there like, how can I make the most money off of this?
Yeah, stroking their mustaches evilly. No, it doesn't work that way. It's just the way the systems are built that are obfuscating this important information.
And I wonder if you're opening a practice, or even if you're already in practice, if you haven't reached out to your pharmacies, if you haven't reached out to a pharmacist who might be in a bigger corporation, I just wonder if I can imagine it making a big difference in terms of you standing out to that pharmacist as, wow, this doctor actually called me about a particular medicine and asked me to contact them if I noticed that there could be a cheaper option for their patient. And so just opening that line of communication could be really helpful in terms of getting information easier or getting better prices, especially for your patients in the future.
Totally. And I'm sure you've seen this in your practice too, but even just yesterday, I was on the phone with a patient who needs to be seen urgently by endocrinology. We're concerned that maybe she has thyroid cancer. We don't really know. But I was on the phone myself with the endocrinologist and their scheduling team trying to get this scheduled. And I was texting my patient, by the way, while it was going on, just telling her when it would all happen, when her appointment would be and all that sort of stuff. And I feel like being the physician and being on the call, it's not scut work. That makes a huge difference. Doors open magically, I think, when we are able to spend the time and pick up the phone and make these connections for our patients. And plus it connects us with the local specialist community and that sort of thing, or pharmacists or whoever. So I do think I want to still maintain that sort of personal connection and not just be asking my nurse all the time to be able to making those calls or that sorts of things, because there's value, I think, in us doing it.
What I'm hearing is it also fills your cup in that it's an extension of how you can help people, not just over the phone or in person.
Totally. Yeah, absolutely. It just felt like a service. And I think the patient felt that way too.
Now, when a patient signs up for your practice, on your website, there's a button that says sign up. And so what happens on the back end after a patient hits that sign up button and they sign up to be a member of your practice?
Yeah, it does. It creates a little file for them in our member management software, Hint, like you said. And then that does connect with our EHR, which is Elation. And so it creates a little file there. And then it also creates a file in our member messaging system, which is called Spruce. So those three are all tied together, which is really helpful. And they're linked, so we can pull that information from one program to the other. So yeah, all goes on, and then we just try to do our best to make sure that we are shepherding our patients through that process and identifying what these different programs are, because they're probably going to start getting emails from the EHR has separate emails than our messaging system. So there is an educational process to onboarding the patients to these programs, but so far it's gone pretty smoothly. Could be a little smoother, but it's been pretty good so far.
And do you find most of your patients are signing up before having a meet and greet visit, or do you find that patients want to have that meet and greet visit before they sign up?
That's a good question. So far, I would say 80% of our patients we've talked ahead of time. So we schedule sort of 15-minute free consults about our practice, or we will invite them over to the practice and have those talks in person. And that's been really helpful. So there are a few folks who just randomly wander into the website and sign up, and I've never heard of them. I don't quite know, exactly who they've been talking to or how they heard about us. And that's fun to see how did that happen? But yeah, for the most part, I do think spending some time with patients ahead of time and introducing yourself and the style of practice pays off a lot.
Fantastic. And one of the ways I'm sure that people have met you to establish that relationship before they officially sign up is when you've done public things like tabling. And one of the pictures that you have in your social media is of you tabling with your banner with the QR code, which I thought was genius because everybody has a cell phone these days. And in terms of if you were busy talking with somebody can still be learning about your practice by scanning that QR code. So I wanted to ask, was this a marketing strategy that your marketing team said, or how did that all happen where you have a QR code on your banner?
That was my wife's plan. She's going to be so excited that you're talking about that QR code. Oh my gosh, I'm never going to hear the end of it. That's she helped design all that and tried to put a lot of thought into it as well. So yeah, I think that's fun too. I think the fun thing about DPC is that there are, for younger folks who know what QR codes are and have iPhones and things like that and understand how all this works, we want it to feel like second nature for them. For older folks who don't quite get that, we also want to be accessible to them. So I think that's what's fun about our style of practice is we can spend more time with folks who may not have a cell phone, who knows, and really walk them through that process. And maybe it does take a little bit longer, but I do feel like we have the ability to be more like all things to all people when it comes to technology and reach people where they're at.
It's interesting that you talk about the differences in age and the adoption of technology there. I was speaking with my cousin who does graphic design on the side. And one of the things she said was, especially for a medical clinic, think about that generational difference and think about the people who might not have internet, who might not have a cell phone, who might have a cell phone, but it is a flip phone, and have your phone number easily accessible. So if there is a barrier to accessing you in terms of contacting you, that potentially is a lost patient. So have that phone number directly on your header page so that at wherever somebody finds you, they can still contact you without having to scroll down to the contact us at the bottom.
Yeah, we've had this debate too about things like refrigerator magnets. Is that a good idea? It seems like it would be convenient. My wife is pretty sure that it seems a little outdated and that people aren't as excited about refrigerator magnets as I may remember. But maybe stickers or something like that would be a little better of a tool there. But yeah, I think that can make a difference too, especially for somebody who's not able to, who does have a flip phone, because I've seen patients who've got flip phones and they're pulling them out and they're rifling through them. And so, yeah, maybe magnets would be the way to go.
I will say that my patients who love their flip phones, for the most part, the handful of people that I'm thinking of, they're so attached to their flip phones because they feel confident using it. And so I feel that whether that be fridge magnets or something else, in addition to fridge magnets, finding out what your patients are using or what they're liking is definitely helpful. And how do you achieve that? You could ask them at their visit. You can ask them in a quarterly questionnaire about your practice. There's lots of ways to do it. But I feel that just the fact that you're paying attention to that and debating over it is really a different world than if you were in fee-for-service and you would never, ever debate fridge magnet or not. When you talk about how a person can need some onboarding to understand what's going to happen in the initial days of the practice, do you have patients who still, after they've been enrolled, don't remember that they have these services that you offer accessible to them?
Yes, and it is frustrating. We don't offer a lot of urgent care straight in off the street for people who aren't patients. However, we have started working with some local chiropractors and physical therapists who might be seeing somebody in clinic and have something medical going on and need to be seen quickly. There's a patient that I can think of who was technically an urgent care patient. They'd come from a chiropractor a couple of weeks ago and they saw them. And the way we're doing that right now is we do enroll them at a discount. And we talk about how this is a monthly membership. I'd be proud to be your doctor, that sort of thing. You can cancel after a month. But basically this visit and any visits you need for follow-up for the next month, they're all included in the membership and the whole 9 yards. You can text me, all this sort of stuff. And there was a patient that I saw who they needed some imaging and we got that done and we're having a lot of pain and then probably need to see a specialist. And I had done what I thought we had done a good job following up with them, even though they were likely to drop off as a patient. And then I just happened to be checking the electronic health record of the hospital system here recently for a different patient. And I saw their name pop up. And sure enough, they had gone to the emergency department for ongoing pain related to the issue that we had seen together. And then from the emergency department, they really hadn't done much except also refer them out to a specialist. But so that was frustrating because I felt like we had spent a lot of time talking about, hey, I'm here for you. Don't go to the emergency department. Don't go to urgent care. We'll get all this sorted out to the best of our ability. And it still happened. So I feel like that will probably happen. But I do want our folks to know that we're here to try and keep that from happening.
Yeah, it's definitely a culture shift, right? We're so used to, is this covered by my insurance, and that mentality. And as we are changing that, as the direct primary care movement is changing that mentality, there definitely is some of that residual, even when patients sign up for a DPC. So I remember Dr. Amber Beckenhauer said she tries to impress upon her patients, if you have any medical question, ask me first, because there's a high likelihood that I can help you, and then think about going off to somebody else. But I think that having that general sense of ask me first is very easy to remember for a patient when it comes to anything medical. And I hear you when, that is very frustrating, especially when you're capable of handling certain situations, especially something that you had already been working on with a patient. And it goes back to also how we have to not train our patients, but we have to impress upon them. This is when it's appropriate to call, like you don't need an urgent refill of Tylenol at Friday at 5:00 p.m. So it all goes together with that relearning of how your clinic works and how you work as a physician with them, because you are working for your patients now.
Yeah, I find that it's such a rewarding mindset. I found since leaving residency and having worked in an urgent care for a few years while I was getting my footing in this new area that we moved to, it's different. I feel like when you're seeing a patient in an urgent care setting and you know that they're not your patient, you still want to provide good care for them, but that sense of responsibility, I think, is not there, just inherent. And the patients pick up on that. And it's been so rewarding to be back in this primary care world and feel like these are my patients and I really do care about what's happening with them. And I want to help them even after they leave the clinic. And I will spend time thinking about them at night. Whereas I feel like in the urgent care setting, it's easy to compartmentalize that. For me, it is anyway, but I missed it. I feel like that's so rewarding. That's why we went into primary care, I think, to begin with, we thrive on that sort of responsibility. So it's fun to be there.
It is absolutely fun. And it's such a cool profession and calling to be in primary care. And when you say that, what I think about is how when I was on maternity leave, my husband would ask about a patient of mine that he would see in clinic. And I would say all of these things about their backstory. Did you ask about blah, blah, blah? Because did you know that she or he does blah, blah, blah for work? Or that 3 years ago, we had a referral out to blah, blah, blah. And that's really good information to know because I did not know that. And when a person is in primary care and is capable as a physician of taking care of 85 to 90% of issues, it is very much rooted in the fact that we know our patients. And so when a patient continues to work with us and know us, and the direct primary care physician is the first person to go to when you have a medical question, it just really hones in on how valuable this model is to save healthcare in America.
I 100% agree. Yeah, it's what we should have been doing from the beginning. And it's sad that we got away from it, but I think it's making a comeback.
When you were hiring Allison, did you post jobs where you were trying to explain the mission of Ember Modern Medicine, or did she find you? How did that all work out?
I got insanely lucky in that I had worked with her previously at our local urgent care. So we knew each other. I knew she was a great worker, and she just happened to be looking for a change as well. And yeah, we talked about the model because I don't think she was familiar with it to start with, but no, she's just been great. And so luckily everything has really worked out well. I anticipate, because I hear this from other doctors like Shane Purcell, who's here locally, there can be trouble hiring in the future as you grow as a practice, and how tricky that can be finding somebody who's on board. And that can be a nurse or that can be a doctor, whoever. But I anticipate that's going to get a lot more difficult if we grow, to be able to find somebody who sort of shares that same vision. And it's going to take a lot more work than it did take for me with Allison.
And in terms of the way that you guys manage your practice, is Allison serving as a medical RN in addition to doing things like back office, front office type roles?
Yes, and we talked about this from the beginning, that this would probably be a role that would need some flexibility in it, because even at its busiest, if I had a full panel, I anticipate that's still going to be often a quieter day than it was back, when we were working in our urgent care. But she's been great and really hopped on board. In fact, one of the big projects for us has been figuring out how this vaccine rollout is going to go for the COVID vaccine. And I basically was able to put all of that on her shoulders, and she's done a great job managing that, because golly, that is a complicated process, registering with the state and having to document where all these vaccines are going on multiple different websites on a daily basis, and then making sure that our refrigerator is at the right temperature and our freezer twice a day, every day. She's just been invaluable in having to figure that out. And it's been one less thing that I've had to figure out as the clinic's been getting off the ground. So yeah, I could not say enough great things about her and how great she's been for the team. But I do think, I don't think people from a traditional medical world are going to have an easy time making the change, because this is just from every role in the clinic, I think is going to need some flexibility and need to be able to roll with the punches and grow and change and adapt. So, some people find fun and some people are terrified of that and probably want nothing to do with it. So finding that right person, I think, is challenging.
How did you handle her contract in terms of how do you reflect all of those roles in a contract?
That is a good question. I don't think we actually have a written contract. So we didn't have to. What have we done? Nope. Just hired her. Don't have a contract. But now that you mention it, we probably should put one together. Thank you. This has actually been very helpful.
It's an honest answer. So that's great. It just food for thought, especially just even as you grow, having something that changes with your practice over time as your roles change and potentially get finer or broader.
She is part-time with us too, I should say. So that has been also pretty helpful because it would be hard to hire her on full-time from the get-go along with the rest of our other overhead. So she's been pretty flexible as far as that goes.
And in terms of your practice in the future, what do you think you're going to focus on for your clinic in the next 6 months versus the next year?
I think what we would like to do, one of the goals that we have is really helping grow this sort of health and wellness community in our town of Greenville. And so we've been really trying to identify other business partners that we could come alongside with and would be able to offer sort of member benefits to our members. So we really want to grow the sort of health community and make it a little more interconnected. And so I think as we identify more and more of these businesses, really trying to make use of this teaching, the shared teaching space that we have, and really get an event calendar going and really come inside their businesses too in any ways that we can. Like there's a local CrossFit group that we've been partnering with who I hope they have a 40 days to fit program, and being able to come in there as a doctor and be able to help follow these patients / CrossFitters through this process of getting back into the swing of things, I think can be a valuable service. So I think that's how we're going to really spend the next few months is networking, growing, and identifying other businesses that we can partner with and try and help as much as we can. And
beyond the first year of your practice,
my goal is as soon as we can afford to do so, to bring on a female physician so that we have a male and a female in the office, because I think that's going to be really helpful for attracting patients and just for our community in general. And then we do have space to grow in our building. So I'm by myself at the moment, but I'm eager to have other folks there with me. I think that's going to be fun for us as we can grow. So I think hopefully within a year, we're able to maybe bring someone on at least part-time and then continue to grow that. But I think really, I don't know if your community is like this, it must be, but I feel like you could have a primary care office on every street corner. In the same way in our community right now, there are dentist offices like everywhere. You can't throw a stone and it doesn't hit a dentist office in our town, or chiropractors, same sort of thing. But primary care should be that way, could be that way. And so I really feel like if in the future this goes well, that we could expand, and there's just a huge need for it here.
And I just think about how, as you're working in this first year, in terms of getting the word out about your practice, getting your expertise out there as a physician, I think that you never know who's going to listen. And so you could potentially have already started that chain of events that leads you to your female physician joining you, or your next nurse joining you, or the next chiropractor to refer someone to you. So I think that it goes back to just anytime you get a chance to tell about your clinic, it's not a bad thing.
Totally. And the other thing that I found in starting up a clinic here is, having worked at the urgent care, you just see tons of people. And as I was trying to get the business off the ground and talking with local banks and stuff, I can think of at least 3 key times when I was talking to somebody who had seen me in clinic at an urgent care and I had no recollection of the event. And they would say, "Hey, I think I saw you," or so whoever, or my banker, it was like his key assistant had seen me. And I go, "Gosh, I hope it was a good experience." And they said, "Yes," because it might not have been. But I think it pays to be nice in every circumstance, because if any of those 3 key people, if they had a bad experience when they were in there, I don't think that we would have gotten the approvals that we've gotten and that sort of thing. So, and sometimes those were years in the past that I had seen them, but they still remembered me. And gosh, so you can never really let your guard down. You just got to be who you are and hope for the best.
Very cool. And along your journey, in addition to the resources that you've mentioned, like Laura's company, like Josh Umber's article on pricing, how you found your pricing in your local community from your urgent care work, as well as the tech that you use to run your practice, are there any other resources that you found useful or helpful along your journey, especially coming from a journalist's perspective? I throw that question out there as a wide net because I feel that you might have a resource that you've used for years and you might not think about sharing it unless someone directly asks you that. So that's why I love this question.
That is a good question. So here's something that I found. I think that my experiences in journalism, I was in broadcast. And so we would have this need to find people to come on air at the last second to talk about whatever the story of the day was. And what I found was it was way more valuable to find somebody who was available when you needed them than whether or not they were great on camera. That availability covers over a multitude of on-air sins, as it were. So I think if you have any relationship with a journalist and they come to you for a story or for a question, if you can, don't say no and try to get back to them if you can. It might mean, in some cases, canceling your clinic for the afternoon and going to be ready to work with the local radio station or TV station or something. But those opportunities are just absolutely golden. And if you can get in the good graces of one of the bookers that you're working with, then by all means do it, because it will pay off in ways that you can't even imagine. And I've seen it happen 100 times. And that would be my advice, I think, from a journalism perspective. If that opportunity arises, don't turn your back on it. And I know the thoughts, you don't have that much experience on being on air, you're going to say the wrong thing, whatever. Everyone's got those thoughts, but you got to start from somewhere. So don't let those get in the way.
Excellent advice. And I think that it just reminds me how all of our experiences feed into who we are as people. And so the fact that you were a journalist prior to becoming a physician, I think that you just dropped a gem on people, especially if they're struggling to get exposure in the media.
Yeah. And it doesn't take much. You don't have to reach out to the New York Times for anything, really. There can be, the way journalism's working right now, there's a lot of overlap in every field imaginable. You could be talking to somebody from what you would consider like an obscure website, but they happen to be a freelance writer and they do work for a major organization. You would never know it. It's usually worth pursuing those opportunities when they arise, if they arise.
Awesome. And Dr. Blank, what is the best way for others to reach out to you after this podcast if they want to connect?
You can call or email. I'm happy to take any talks or take any calls. My phone number is 864-702-2365. That's our clinic number. It goes straight to my cell phone. Happy to chat and go over any questions anyone has. My email is Brian with an I at embermodernmedicine.com.
Thank you so much, Dr. Blank, for joining us today.
Hey, this is my pleasure. This is so much fun.
Next week, look forward to hearing from Dr. Becky Lynn of Evora Women's Health in St. Louis, Missouri. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, including DPC swag, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Concepcion.